further ado, Dr. Shrivastava, the floor is yours.
His Excellency, my friends, Shiv, and members of this organization, Sahyog, I am indeed privileged today to have this opportunity to talk to each one of you, particularly the students, young and bright, the future of our country and future of every society. And just to explain in one line, किसी चिराग का कोई मका नहीं होता, जहां रहेगा वहीं रोशनी उठाएगा. Our students who come from India, they come with hope, aspiration and commitment. They want to excel and make a difference to this society. There is no doubt about it that they will do it. But as society is changing and transforming, time is progressing, there are problems too. When our students come, they come with a lot of wisdom and intellect, but they also need to know that problems of psychological medicine follows them. Wherever they go, there is some problem. But having problem is not a problem. Before that, there are answers available. So I want to assure those who have recently come and those who are going to come that Canada is a resilient society, it's very caring, so they must be assured about it. I must place on record, the government of Canada is quite sensitive towards mental health, and recently it has allocated a money of $50 million for suicide prevention, arrangement and research. That's the society here and how committed the governments are. But let me also place on record that problems are not up to one particular agency to solve. It's beyond governments. And it cannot be sorted out unless people join. And that's the purpose of this workshop, that we want to assure them there is a society which is ready to take the responsibility. And the students who have the problem, it is also up to them to challenge the problem and deal with it. The battle here is not only academic, but it's cultural and also social. So whenever there is any problem which is originating, we have to see these 5 things in mind, which are cause as well as the consequences. The first is social, the second is psychiatric, and the third is academic, and the fourth is medical, and the fifth, most important, is spiritual. Few years back, it was not in fashion to talk about spiritual aspect of health. Let me also place on record that proposed definition of health by WHO is 4 pillars together: physical health, mental health, social health, and spiritual health. I will be including in this context the benefit of spiritual medicine and spirituality. So why are we talking about young people? There are a couple of reasons. One, that this age, 14, 15, 17, 18, when they come here, is highly sensitive for mental problem. About 50% of all medical and psychiatric disorders begin at the age of 14. And about 75% of serious mental illnesses begin between age 17 and 21. That's one of the reasons that we have to care about young people. And the second, when they arrive, there is a stress. And as we all know, stress leads to physical problems like diabetes, like hypertension. And physical problems again lead to psychological difficulties. Having psychological difficulties again leads to chronic medical difficulties. For example, somebody has stress, it leads to depression. Depression leads to diabetes or hypertension, and those physical illnesses always lead to some or the other psychological problems like anxiety and depression. So there are 3 or 4 time place where psychological problems are likely to happen. First, when these students arrive. The second is the time of examination, and the third is any time during their stay in the university and the colleges. Main problem begins when they arrive in the country. The cultural changes, traditions in the society here, which is not very familiar to them, is one of the challenges to deal with. And the second, a lot of students who come here also had experienced the physical and mental health problem in the past. They have been under treatment or management for their stress, depression and anxiety, and when they come in this country, those problems increase, are likely to increase. Therefore, it is not only that when the students come here, the problem begins. In fact, the problem begins from the time they make a decision to come. It is important to realize that decision to come abroad for studies is not very simple. It's complicated. Back home, our life is a family life. It's always a joint decision. We don't know who has decided, whether the students, their parents, or the families. We don't know if there were financial arrangements or not. And all these factors keeps on bothering them and increases the psychological problems. As I said, that they are already highly vulnerable. And vulnerability comes from entire life, from childhood to young adults. Those who had healthy childhood, had everything which has built up their resilience, are lucky. But there are problems of psychological origin even in childhood and adolescence. When they are passing through a transition in biology, transition in social life, transition in deciding the career. And whenever there is any transition, it's a sensitive period to develop mental health issues. So we have to understand, and we have to make those students also to realize that how vulnerability arises. For decreasing this vulnerability or to deal with it, we need a comprehensive and concerted effort by everybody. So when anxiety appears after they come here, it is very common to see developing depression. Next time when you go at the airport or when you are traveling in a tube station or going to your university, try and remember, every person in 10 is likely to have depression. At least 1 in 20 people are likely to have suicidal ideas. And these are the issues which remain dormant. They are not seen on the face. And sometimes unfortunate events take place and depression leads to suicide. And thus anxiety, depression and suicide, they become problem on a same continuum. They cannot be seen in isolation. In fact, the mental health issues by itself is not seen in isolation. There is always a social cause. Psychological difficulties or mental illness is not caused by just one cause. It is multifactorial. Number of factors join together and in a complex manner lead to mental disorders. Now, to have mental disorder is not a very big thing, I would say, because people have capacity and resilience to cope with it. They can deal with crisis, but only sometimes when they are under other pressure, the crisis becomes enormous. But it is also true that crisis is to be seen as an opportunity. When the crisis appears, individuals' resources starts decreasing. The mental capacity starts getting compromised. But at the same time, crisis is an opportunity when newer coping mechanisms develop. The students learn by themselves what to do and what not to do. But some students who are unable to think in this direction, they need support, and support in form of social life from their family and friends. Nowadays, university well-being clinics are set up in every university and every school. Generally, they have enough support, but unfortunately, they fail to access the support which is available. So our first responsibility is to make them aware that help is available. It is seen in a number of studies that most of the people are unaware and do not access care because of stigma. Mental health problems and mental illness is, people don't talk about it. It's highly stigmatized. With this background, I will share with you some information which you will like to see and you will appreciate. Can I have my slide sharing? Can you connect me, please? Yeah.
Yes, you are already the presenter. You could you share yours, or I could share yours.
Yeah, no, I'll do that. Yes.
Okay. It's working well. Yeah.
Yeah. So, hope is immortal, and this is something which carries our entire life. It keeps us alive. There is no problem which cannot be sorted. Now let's see how this subject is being studied. If you see the number of publications in last 10 years, it's about 280,000 papers which have been published in last 10 years. And particularly about 95,000 papers have been published in last 10 years about student mental health. Thus, it reflects how our scientists are sensitive. They are carrying out research and trying to find newer methods to deal with it. At the same time, the scene about mental health in India is that mental disorders among people with physical disorder is about 40 to 50%. That means half of the people who have any kind of physical disorder also have psychiatric disorder. The overall current mental health morbidity that means is 10%. And at the same time, the common mental disorders like depression and anxiety is also seen in 10% of the population. In fact, in Canada, 1 in every 5 persons is suffering from a mental disorder. It is also true that in developed countries, about 20 to 30% population do not have any access to care. It is true for Canada and even for the United States, leave alone India, where we hardly have support for treating mental disorder. Similarly, in child and adolescent, in rural and urban areas, also the problem is not less. It may vary between 1 to 10% to at least about 25 to 30%. And these are the vulnerable children and adolescents who, when they immigrate to this country, they suffer from more and more problems. We also do not talk about female mental health or women mental health. About 10% of pregnant women suffer a mental disorder, and after pregnancy, about 20 to 30% women also suffer from mental disorder. An important aspect is genetics. We all feel that it is our environment and it is caused by social and environmental factors alone, but that's really not true. There is a genetic component, and in about 10% people again, mental disorders are related to genetic component. So World Health Organization conducted a study from 8 countries and tried to find out what is the status of mental health disorder. In a large population of about 18,000 students, they found at least 35% suffering from mental health issues. And another study by WHO, they found 37% people suffering from mental disorder. But the good thing was that when they were treated, about 40 to 50% people reduced where they responded well with the treatment. Thus, if the treatment is available, a lot of progress can be made in keeping their mental health in a good shape. Therefore, if celebrate life and prevent suicide, though the problem is that every 40 seconds in this world, one suicide takes place. And in India, about every hour, one student gives up life, which is so challenging for the society to handle. We conducted a study in an engineering college for third-year students, and what we found that about 6% of students required immediate psychiatric intervention. Another about 7% required immediate psychiatric help, and about 12 to 13% people were guided that they will need counseling. It is wrong to feel that in young age, situations like substance abuse, alcohol and drug is any lesser. In a study which was conducted in Northeast India, we found that about 40% high school students had problems of alcohol and cannabis abuse. So the problem is not small, it's quite enormous. The government of India's statistics show that about 135,000 people kill themselves every year. And out of that, about 10 to 12,000 are students. Another study which we conducted in India, it's about a helpline. We were managing this helpline for the city of Mumbai, and we published a data for 15,000 such students. And what we found that there were 3 different factors which were very common. One, relationship. The second is finances. Problems of finances and economic aspect was a significantly higher risk factor. The family problem was another risk situation. So there is a lot to be done for keeping well-being of these students. Now here in Canada, Queen's University conducted a large study, and it demonstrated that depression was found in 15%, anxiety in 14%. People who considered suicide at any point of time were 4%. And those who considered suicide in the past were 10% of the students. When we extrapolate that data and see, and I believe there are about 200,000 students in Canada, Considering the ratio as per the study of Queen's University, we would find that at any given point there will be around 20,000 students who had ideas of hurting themselves in the past. But if we see how many considered suicide at any given point of time, it's 4%. That means around 4,000 students were such who were at serious risk of attempting suicide. Depression, 15%. That means at least about 30,000 students are at risk for depression. So this is the liability of mental health amongst these students, and as society we have to think an arrangement for helping at least this number of patients, of students. When I extrapolate this data further to find out what is the liability of suicide, and we consider about 4,000 people who had suicidal ideation, it is expected that about 160 students in a year would attempt suicide. If we apply the international epidemiological and statistical data, we would see that about 12 students per year would have attempted suicide. So about 6 to 7 students every year are expected to have killed themselves or face this unfortunate situation. So this is the dimension of work that we need to do and help our students to get out of these difficulties. Now in this background, let's think about body and mind. Why does it happen? So the students who come with high stress, they develop depression and as well as such conditions like diabetes and hypertension, which again causes more stress and leads to depression. Depression is now one of the risk factors for heart attack. So it is not only psychological problem that we are dealing with. By helping them for emotions, for mood regulation, for problems of thought and memory, it is important because we will be saving a lot of physical disorder. Now, why does the brain, mind and behavior matter and how does it arrive? So, the brain changes are major source of problem for mental difficulties. Mental difficulties are also related to the environment. When students come from one environment to another environment, change in temperature, change in humidity, and so many factors in the environment are also responsible for changes in brain and therefore in psychological health. When people leave one country and go to another country, they go through the stress of migration. And that is another factor to deal with how smooth can be their transition from one place to another. Vulnerability of these students leads to stress. Stress leads to psychological symptoms. Psychological symptoms get transformed in psychiatric disorders, which then develops into physical disorder. And these physical disorders further increase vulnerability to develop mental health issues. Now, if you want to handle these problems, how can we do that? We don't have to only think about psychiatric interventions. We have to combine number of factors like creating conducive atmosphere in the society, providing medical support, providing support for their academic life, and bringing changes in their spiritual experiences. So when students come in this country, some of them come with history of psychiatric problems. It again leads to stress, and as I said, number of other problems do come up. How do we recognize these symptoms? The psychiatric symptoms are manifested by changes in mood, in thought, in behavior, and in memory. We often feel that those students who are intelligent are not likely to face problems, but that's not true. Intelligent people face as much psychological problem as those who are less intelligent. But intelligence can be of social intelligence, intellectual intelligence, and emotional intelligence. How students can get together, connect with each other, utilize the resources, can deal with their isolation, discrimination, and harassment. All these issues are important to save person from developing mental disorder. As I said, transition is very important and one of the key factors to prevent mental disorder. Like people in teenage develop psychological stress and trauma, which leads to mental disorder. And this transition is much more prominent in colleges and schools. So, no health without mental health. With this background, I come to the important aspect of suicide. Suicide is a personal tragedy. We cannot blame the students that why they have attempted suicide. We cannot blame our students that they are responsible for suicide. In fact, everyone around them is responsible, either for unconsciously creating an environment in which they do not adjust, or falling short of providing a protective environment. Suicide does not happen due to a single cause. There are several risk factors which give rise to an attempt of suicide. For example, substance abuse, alcohol, the history of previous psychological ill health, history of having mental disorder in family. So these are some of the risk factors, we say, which lead to suicide behavior. Suicide is not preventable. That's the opinion of some experts. But I believe, and many like me believe, that suicide is a preventable situation. Often the question is asked, what can we do when we find someone talking about suicide? If that's the case, we have to do a number of things. First, take control of the situation. So if you find someone, your son, daughter, or friend, somebody visiting to your house, to a family whom you know, is expressing suicidal ideas, that's one of the strongest risk factors. So it is important to take control of the situation. Make sure that the student who's sitting next to you or whom you know does not do anything which is harmful to them. Create an atmosphere to deal and provide comfort and compassion. It is also important to know that by providing only temporary relief, things do not become all right. One has to make sure that they do not have access to anything by which they can hurt themselves, like some poison available in the house, chemicals available, or some people keep gun in their house. That's the culture here. These things, if they are available, it becomes easy for people to take it and attempt suicide. So therefore, as a family and friend, it is important not to leave people in loneliness or disconnected till the time comes that you can arrange a medical help for them. So there are These kind of things which we need to provide in terms of help and to remain vigilant, to recognize that they are at risk. And depression is one of the foremost situations which leads to suicide. When you find someone depressed, it is easy to help them. The changes of mood can be seen very prominently. People lose sleep, they stop eating, they isolate themselves, and finally they stop going to the college or their classes. And in this manner, they decline in their academic achievement. So these problems present with emotional difficulties which leads to academic difficulties. So if we have to save students' academic career, it is important to provide emotional first aid and emotional support. Sometimes these students have attempted suicide and they have been treated in a hospital. One should also know how to receive these students back home. The duty of the family is not to become complacent. Repeat suicide is very common after having a suicide attempt. One should follow the doctor's advice, continue medication, continue the treatment with counseling. There are again several myths in our society, and it is felt that those who talk about suicide will never attempt suicide, and that is wrong. Most people who attempt suicide have tried to connect with someone or the other, and this opportunity has been missed. We have not been able to recognize that they are the candidate who are vulnerable. The other misconception which people have, that it cannot happen to my children. It happens only to others, because we have well integrated family, we are well off in the society. It has nothing to do whether somebody will attempt suicide or will not attempt suicide. Another set of misconception is that suicide does not recur. If someone has attempted once and that is all done, it will not come again. That's not the fact. About 20 to 30% people who have attempted suicide, they go on to repeat. And therefore, when you see somebody who has attempted and be treated in the hospital and you get them back in your house, be sure, be careful that it might happen again. The only way to save this is to continue to talk and talk. Discussion helps most. The talking treatment is as good as any antidepressant. Antidepressants or any medication help only up to 30 to 40%. But if you combine with psychological intervention, the results are very rewarding. More than 70 to 80% people recover. So talking, having a dialogue, establishing communication, providing them emotional support, dealing with the conflict, teaching them how to deal with the conflict, how to solve problems, how to make decisions. These are the important things which we have to teach, and we have to provide these skills so that they can deal with their own problems. Now, the big issue in front of our society and organizations like Sahyog is what to do in a broader terms. So there is one which is public health approach, where you do things for a group of students, and there it is the governments and society to create an atmosphere and arrange number of measures to help them. And the first one is to identify. If we are not aware and we cannot identify, we cannot do any treatment. And the second one, you are helping to a particular student who is at a risk for suicide. As I said, the responsibility becomes much more. It is important to identify the problems. If a person is crying, depressed, are isolating themselves, it is likely that he may be thinking about suicide. About 20 to 30% students at any given point of time in any university have suicidal ideas in their brain. More, it is found in professional institutions, in medicine, in engineering, and so on and so forth. If we are able to identify people who are having such ideas, because if we can identify depression, we can identify potential people who may attempt suicide. And therefore, this is some of the steps how we can prepare a plan, progress, and try to help individual students who come to this country. I think I will stop here with this brief introduction, and I'll be happy to respond to any questions that come up. Thank you very much.
That's it. Thank you very much for a very informative presentation. We open the floor for questions, and Rajesh ji, please, if you could go through some of the questions that have been asked. I think one of the major things here that informed to me is medication is 30-40% effective, but talk therapy is up to 70 to 80% effective. So, we all have a year, we all have some. I think we need to encourage people to talk about the issues they're facing, because that's very, very, very helpful. Rajesh, over to you.
Yeah, sure. Okay. So we have some questions. They were sent to us, and we also would open our chat feature on the right side if all the participants, they could also use. So one of the question is how the near and dear ones, let's say you are the roommate of that person who some event has happened, or they have coming, they have not, they were not successful, or they were successful. In each of these cases, the roommates or near dear family members, in both cases, in one case they are thinking about it, how they should react. Dr. Shrivastava, you talked about like taking control of the situation, some of that. Maybe more adults can take, people who are more experienced, professional, they can do that. But for these younger people, like they are their roommates, how should they handle themselves? Like how they should, what they should.
So it's an interesting question what to do, and it is in fact most critical question what to do and how to find out. And the first thing we need to know that they have to have mental health awareness education. Unless they know how suicidal ideas can be there in someone's mind. And some of the signs how to recognize is students start disconnecting. They start stopping their communication with others. So if you have somebody who has not gone out of the room for a number of days, need to be on alert. If you find that somebody has started going out for drink, cannabis and other things, it is a point of worry. If you find that somebody's behavior is changing, for example, he has become more irritable and without any reason he started throwing temper, that is another sign of depression. Persistently crying, losing weight, becoming irritable are some of the signs of depression by which one can recognize. Now the second part is if somebody is talking about suicide, that hey, I don't want to live, I want to hurt him, I said. Now this is a difficult situation, and people often get confused what to do, what not to do. And my advice is not to leave that person alone. Develop dialogue, continue to talk no matter what, because it is dialogue and communication which helps until the time you can arrange for professional help. Often people do the mistake that let's go out and go for a drink, and I think that's a potential disaster that happens, and it is very common in the population of students. So students must have information about it. Unfortunately, what happens, that we talk everything but mental health. It is important to form the student community and have counselors. Once you have student community and they are interacting with each other and not isolating, that would be the great help. And as I was referring what can be done for a particular student, the important thing is that when the students arrive, you have to have a mental health assessment. We can always help and develop a design how to do mental health assessment when people arrive. There are very good structured tools available that may take only 5 minutes to administer, and one can find out who is at risk and who is not at risk. So if in a society, say about 100 students are coming to Canada, it is important to arrange for their mental health assessment when they come. That's part one. And second, before they come in the country, we should have a mental health data. So we may have to have a system that before they leave the country, they have seen a counselor and they have assessed, and we need that information. It is important to find out what was the mental state before the student started for the relocation to Canada. What was his attitude? What was he worried about? Did he have financial stress? Was anybody sick in the house and he was feeling guilty about? All these factors are very important. So I will tell you that one of my colleagues called me up that Mr. X is going to Canada for further education. And he was treating that student, and he said, I'm worried about it because he cannot take medication and we don't know how he will manage. And when I advised that this is not the time to really go for taking up this assignment, families do not listen because there is a lot at stake. But the right thing to do is to hold on, not to push this candidate, not to push the student who is at risk. Now, if there are other situations where I have to receive the students, those who have dubbed or problem, and when you tell them that go to the nearest emergency and seek help, a lot of stigma, they get worried that it will go into their educational record and they feel that it might hurt their career and they might not get a job or might not get to proper progress. So I think education and arranging for assessment, what we call identification, is important to arrange, and in this manner we can help a student and help the student community at large.
Thank you. So there's another question about, these are the tendencies of, maybe it's more cultural in Indian context and maybe in all others. When somebody talks about mental health issues, we know they are at risk. We try to fix them. You say, oh yeah, something is wrong there or not. Do this, do that. Like, we have very simplistic solutions. So how can we, for us, somebody who's not trained, those people, how can we can have a simple method, something, rather than trying to fix them, get them more like become aware about it and get over the stigma and connect with them. So what would be a good approach for somebody who's new to the field, rather than having the tendency to fix them and just get to the next level and make it more like
yes, yes.
with the profession?
I get Rajesh. This is an important aspect of the topic, that what to do in such a situation by people who are not aware. And I think here lies the problem. In population, people are not aware. Now think about it that we are having about 20% population, 30% people in our population who are at high risk. So if somebody has heart disease, everybody talks about it, and they want to have more information, that do exercise, have a right kind of food. This is because of awareness. But unfortunately, we do not talk about depression. That depression can be in anybody, and it appears in about 10 to 15% people. So if the caretakers, that they have information, for example, if you have a student who is under your care or you are the guardian, it is important to know what are the mental health signs and symptoms. Unless we know and we talk about it, we would never be able to really deal with this. So awareness and education is the key component. Now until it cannot happen in a day, until that happens in a mass basis, as I said, it is not, the best approach is to take control of the situation. If somebody has expressed the idea of suicide, do not take it that it is a temporary phase and it will pass out. No, it doesn't happen. They continue to have this idea unless something is done. And what best can be done is to talk, discuss, connect, and be compassionate. Find out what is the nature of problem, whether it is emotional or it is a social problem, or there is a cultural issue, or they have any conflict which they are unable to resolve, or they may have problem in taking decision, and so on and so forth. So there is a lot which can be done by the members of the community and the family members. Often we, because of our attitude, we make mistakes. For example, one study was done in India where the doctors asked people who had attempted suicide, and majority of them said, I would not have done it if my family would have supported me, only if I was heard. So there is a miscommunication, there is a shame and stigma that we try to neglect and do not respect the person who has attempted suicide. We feel he has done for attention seeking, and there is nothing like seeking attention. Seeking attention, that means speaking. He is trying to communicate and tell you that, look, I am under distress. So this kind of small approach, minor things to identify the distress and stress among individuals, try to communicate, take emotional support, are some of the measures which can be employed.
Okay, all right, thank you. And one last question, and unless there are more, like you touched upon this creating communities, let's say within the Canadian context.
Yes.
Because this should be a next step. How would you see these communities along the regional linguistic, like the India linguistic, I'm talking about Tamil or Gujarati or Hindi, along those, that which way probably, or maybe at college level, or maybe regional level, what would be, because that probably is the next step we all have to work towards. How would you vision that type of communities?
I think we have certain responsibility. And as I said, take control. What I mean that we have to have a community contact. So every student who arrives must have a contact resource with somebody or the other in the community. What we call as community mentor. So if there is a candidate who keeps in touch with X, Y, or Z in our community, it will be easy to make him aware and monitor. So the first step would be to try and fix responsibility or try and fix a social connection. Each one in the community can take care about one student, and that will make a sea change in their life. Just to have somebody to talk to, connect, come and meet you in festivals or going somewhere else will give you an opportunity to find out whether he is developing a drug addiction or he is not attending his school or colleges and he may be at risk. So the first step is to create mentorship in the community. So once the person has come, we have screened whether, so you screen 100 students and you find that 10 or 20 of them at a high risk. It is our duty to find out 20 people from the community and connect the two of them. There is also a lot of resources available in the colleges and the university. Every university has student mental health clinics or well-being clinics. So it is important that community mentors connect with those clinics and encourage them to access the help which is available right in that college. So if there is a triangle, community mentor, college mentor, and the students, what I call it, enlarge the circle of care. So have continuous contact with the student, the family back home, the college counselor, the teachers, and agencies of the government can be of great help in making that assessment or making some arrangements so that students do not feel bad and they still go through the assessment. There are scales available which are very simple, available in public domain, and it can be used to find out who is at risk. So there are some measures like this which we can develop as a plan and implement and see maybe on a pilot basis in the beginning whether this helps them or not. Once you find that it is feasible or doable, you can enlarge the plan and develop a good strategy to really spread how to handle almost all the students who are coming in the country.
One of the things, Rajesh, you want to speak for a few minutes?
Yeah, go ahead.
One of the persons I knew who was going through some serious mental health issues for a very long time. And I used to call him and he used to call me often. And one of the things he always mentioned, he said, you can go to the professionals. But professionals, you have to make an appointment. And they may not be available when you need them.
Yeah.
And he said what was more important to him was whenever he needed, somebody was available just to talk. And it had to be professional. So I think if we can have that kind of community members available for, they don't have to deal in a professional manner, but because for the professionals you have to have an appointment, we'll see, and they're only there for one time, like certain time, and they're watching their clock or whatever, we'll get on your next appointment next hour, or week from next hour and all that. And one of the things he always said was that sometimes he just needed help at that time, and all he needed was an ear or somebody to talk to, and somebody gave him some nice help. So, Dr. Shrivastava, we should ask him that.
So, this is a practical problem that you are referring to, but there are answers available. One, that it is not true that help is not available. Number of agencies from the government, they run 24/7 helpline. There are good services, and I know that Canadian Mental Health Association has the telephonic counseling help available, and there is no waiting list. You dial, you'll be able to talk to somebody, they will connect you to professionals. And it is not true that professionals always have a long waiting list. That happens only in the practice, somebody who's doing private practice or somebody is in a big institution. But there's a lot of help between the two. I think the resources available from Canadian Mental Health Association is a great resource. Having said that, the primary contact is what we call as lay counselor, that anybody in the community can be trained to provide that counseling. There is a gap which we need to break, no doubt, but it will not be possible unless we have more manpower, and everybody can be an ambassador to really walk into that role. That's why I said that if you have mentorship, those people can be trained to deal with this situation. And the basic thing what we see in our communities, in our families, that if you are compassionate and you are able to talk and strike a dialogue, a lot of problems can be sorted out, and you can then establish professional contact and have it more treated. Those students who have serious mental health problem, they will require continuity of care. But that happens in only about 50% of cases. Another 50%, those who have very transient problem, say they have some anxiety, until it is resolved they may be in crisis. So they might require help only for 2 months or 3 months, and after that it's over, it's all, they become alright. So the resource from community mentors is an important and key factor. We can train maybe 10, 20 people in each and every city, each and every community, what is mental health, how to identify mental health problems, and in the meantime connect with the government agencies. There are resources available. For example, if you can encourage that student to go to the university well-being clinic, clinic for mental health, there are psychiatrists who regularly go and attend. So these kind of resources, people are not aware about it. we can develop a networking. Say for example, if you have a group of students coming from India and you want to help them, it is important that to connect with all such clinics in number of universities, form a consortium and go from there. So it's a possible and doable thing. Only what is important is that we think about it, sit down and create that model. Unless the strategic model is created, we will not be able to make a progress. So that would be my answer to your problem.
Yeah, perfect. Thank you very much. I think considering the time and also what we have discussed, I would like to just thank all the participants here, of course, and then just a few takeaways. Of course, very big thanks to Dr. Shrivastava for providing us, all of this information that's very relevant for